Hello, everyone. I am happy to be here with Dr. Laura Koniver today. Dr. Koniver, good morning.
Hi, nice to see you again.
Thank you. I'd like to do a short introduction to Dr. Koniver, and I say short because when I give a partial list of some of the things she's achieved, we could probably spend the whole time doing nothing but talking about those things. She's a medical doctor. She's an author. She's a holistic physician, an inventor, public speaker, a movie star, and a mother. Dr. Koniver, welcome again.
Thank you. Thank you so much.
We're here to talk about your book, The Earth Prescription, and focus on some of the things about grounding.
Mm-hmm.
And it's hard not to read this book without feeling entirely positive.
Yeah, I mean that was definitely the goal. This is literally something we all innately know. So let's just remember it. It should just be very uplifting.
It was. It definitely was for me. And would you agree that most people don't understand a lot about their bodies, especially in terms of how important electrical functions are with our bodies?
Yeah, most people don't have any idea how conductive we are. And I can't even blame, it's not like most people don't know it, but then doctors do. Even in the medical field, we're just starting to understand conductive medicine as a healing modality. I mean, we monitor brain waves and heart, EKGs, EMGs, that kind of thing. So we know how to use electrical conductivity to diagnose and see problems with the body. But for some reason in medicine, we haven't really started using conductive healing to realize that this is an avenue of delivery of health. So grounding seems like a new thing. And it's something that even in the medical profession, most physicians aren't still saying the word, have you docked your body to the earth? Have you grounded your body for your electrical and conductive health? I mean, even physicians don't know. So yeah, I would say most people don't know, healthcare practitioners included.
And, you mentioned the electrical influence from outside our bodies.
Mm-hmm.
What types of things are we subjected to each day that we're not even cognizant are doing harm to us?
That is that could be a whole interview in of itself, because not just what everybody hears about 5G, your cell phones, your computer, but even just old fashioned, a lamp by your bedside, the cord has its own electrical magnetic field that it's resonating. And, the power lines and the cell phone towers, and and then we're constantly inventing new ways to add more electrical and artificial man-made EMFs into our living space, which sort of is its one whole ball of wax, because that does affect the body in a negative way. But natural EMFs is grounding. The earth itself has a natural pulse, a Schumann resonance, that is a healing zone for the body. It instantly relaxes and releases tension from the body, and instantly tissues start regenerating and healing. So the trick is to directly seek contact with healthy EMFs and to avoid at least prolonged exposures, if possible, with man-made ones, because that's how conductive our body is. It can respond to both.
Well, and just to give you an example, when we were creating our grounded mattress and sleep system,
Mm-hmm.
I made a voltmeter and attached it to my hand, and I took a big spreadsheet, and as I walked around the office, I would record how much electricity my body was subjected to. And one of the worst things that I found, for example, was holding a cell phone that was charging.
Oh, yeah.
2 to 3 volts routinely.
Yeah, absolutely. And this will show you the power of grounding. So there was a recent medical study looking at babies in the NICU. They weren't supposed to be born yet. They were born prematurely, so they were on intensive life support. And so they were in incubators because they couldn't regulate their own temperature, heart rate regulation, that kind of thing. So in an incubator, you can imagine power cords, everything electrical, electrodes attached to their little teeny tiny bodies. So they were in immense man-made electrical fields, but in the attempt to keep them alive. And when they grounded these little premature infants, their heart rate variability increased, their biomarkers of longevity increased, they became healthier, their heart rate stabilized, their temperature stabilized. So grounding the body in the midst of all of that helped these premature infants become more robustly healthy. And so that just shows that the power of grounding to negate and to help heal, even in the presence of some of these man-made exposures, is really powerful.
And in a case like that, how long does it take before someone starts to feel a benefit from grounding?
I would say you start to feel benefit literally within 1 second, because there's medical studies that show the second that any part of your body, doesn't have to be, it could be any part of your body. It could be your foot if you're barefoot on the earth. It could be your back if you're laying on a mattress. It could be your fingertip if you're touching a tree. Instantaneously, your muscle tension all over your body, even in distant areas of your body, instantly decreases, and your brain goes into a healing brainwave pattern, and stress and tension start to leave, and your circulation starts to improve. So that's instant. But in the NICU study we were talking about, they grounded the premature infants for only 40 minutes, and they still had that robust boost to their health in just 40 minutes. So most people suggest, I mean, I believe there's instantaneous benefits, but most people suggest 30, 40 minutes to start really feeling good. And then there's cumulative benefits to grounding for hours and hours and hours.
Well, there's a lot of things that you raised in that answer, and I'm going to try to remember them and kind of back through and ask some of these questions. So let's say that two people are both grounding. Will they see the same benefits, or will their bodies react differently?
That is a fantastic question. And Rob, nobody's asked me that before ever. I would say that their bodies have the same benefit, but they might not feel the same. So if someone's accrued inflammation and they have a bunch of chronic illnesses, they might not feel instant relief, even though those illnesses are starting to be negated. And, you know, health is starting to be infused back into them. But someone who feels pretty good might instantly, or someone who's even just really connected to their body on a mind, body, soul kind of level, they can really feel tension. Or if they had started to get a tension headache, they can literally feel it drain out. So I get some people, tell me, why don't I feel any different? But on a, microscopic biologic level, your cells are being conductive. Your heart rate is being stabilized. Your digestion is being boosted. But they might not feel it. They might be full of tension or have other chronic illnesses going on that they can't instantly feel it. But I would say most people do instantly feel the difference.
Excellent. In your book, The Earth Prescription, you detail, I think, 67 ways that people can ground.
Yeah.
And in reading the book, I feel as if you're moving from, take an analogy of a dam where, when a dam springs a leak, what do? We react to plug the hole.
Mm-hmm.
But what you've presented here seems like we're reinforcing the dam to prevent the leak from ever happening, if that analogy makes sense to you.
100%. And that is a little bit why I moved into holistic medicine and away from conventional medicine, because it's exactly what you said. In conventional medicine, we can just try and troubleshoot and fix, and we need that. I mean, if we have an accident or break our bone or, have a major trauma, of course we want someone to come in and plug the dam, but that absolutely 100% is not supporting, protecting, or boosting our wellness at all. It's just waiting for the next thing to happen. And of course, we're human bodies. We're going to have the next thing happen. So to treat healthcare as just trying to put fires out is not ever making someone feel wellness. And so with grounding, I agree with you. It not only can decrease inflammation, decrease your chance of having a blood clot. I mean, really, truly decrease your chance of major morbidity and mortality. But also it does boost wellness. Also, it does put our body in that healing state that's natural for us, that we were supposed to be in before all technology sort of kind of made us lose touch with day and night with the artificial lights and all those EMFs. So it's protective. I agree. It's pretty much the only healing modality that I know that is not only able to troubleshoot, but is also protective for the future.
And again, I'm trying to keep up with so many of the good points that you're raising here. But for example, when you talk about the body as a whole, let's say I had a surgery or I'm on medicine. How will grounding affect my body with respect to either surgery or the medicine I'm taking?
It would depend on what medicine you're taking, but and what surgery you had. For surgery, I don't recommend it immediately after surgery, because one of the positive, most wonderful things about grounding is it boosts your circulation. So it lets your whole body get oxygenation. It lets your whole body get the nutrition you ate. It lets your whole body release toxins. I mean, it's really, really good by encouraging circulation. But at the same time, if you've recently had had surgery, so you've had an incision, it will increase your body's ability to then bleed. So right after surgery, I don't recommend it, but in the healing process, 3-4 days out, once the wound is closed, Absolutely. You want to be grounded because not only does it boost circulation so that we can start regenerating and repairing tissues and really healing, but it also decreases inflammation. Blood markers of inflammation decreased. So you want that. So you will recover more quickly with less pain and in a natural state of wellness, grounding, but just not immediately. And so the same with your comment towards medications. There's not a lot of drug medications. There's only a few. And again, they're all because of how your body is actually healing. It's all a positive thing. So if you're on artificial blood thinners, that's artificially making you more likely to bleed. Actually, with grounding, you're less likely to have a blood clot anyway. So you'd want to work with your doctor and probably decreasing your dose, or, you know, so that you can measure your coagulation of your blood so you don't have it too thin. So it's really when you start going natural with grounding, what you can decrease is the artificial fake prescriptions that you're on usually, but you want your doctor to look into that with you and monitor it. And the same with thyroid. So grounding after just a few days has been shown to boost metabolic function and thyroid function. So if people are on artificial thyroid medications, it's possible that they can decrease those too. And so those are the two main ones. And again, it's because your body's actually healing, not because there's really an interaction that's a bad interaction or a contraindication. It's not really that. It's that your body's starting to heal. So you want that to be looked at and monitored.
And with the heightened state of your body, and I think you actually referred to it when someone starts to ground, their body goes into a deep healing state.
Mm-hmm.
So if they're in that healing state, would that help their body process the medication better and more efficiently?
I would love to give you an answer for that, but I will say, even though we've had over 20 years of medical studies, I don't think that we've ever looked at the actual metabolism of certain drugs and if that's expedited. So I don't have an answer for that question, sadly.
Okay. So now you talk about how quickly one can benefit from grounding.
Mm-hmm.
Is there a benefit or I should say a disadvantage for grounding too much?
Oh my gosh, no. I mean, the natural state of human beings and all living animals, plants, everything is to be connected to the earth. So obviously the earth gives us everything we need to sustain life, from producing the air we breathe, to the water we drink, to the ground beneath our feet. And so being connected to the earth is totally natural and normal. And so I believe there's health benefits that accumulate, not that there would be any disadvantage to long periods of time. And medical studies are reflecting that. When we don't have any that go for decades yet, but we have studies that go for days, weeks, and months. And the more someone grounds, the more the health benefits accumulate, for sure.
And, you know, we make a grounding mattress, and I've been dying to ask this question because I've told this to a number of people when they get the mattress. The first 2 or 3 nights I slept on it, especially, I had the most vivid dreams, yes, I think that I've ever had. Yes. I think over time, I still have the dreams, but they weren't as vivid as those first days. Is there a reason for that?
Yeah, I think you probably still have just as vivid dreams, but the contrast isn't there because, you know, you weren't used to having dreams, and all of a sudden you're like, wow. And it's because your brain is in a deeper, more restorative sleep pattern when you're sleeping at night. So it's going through REM and it's dropping down and staying in restorative alpha brainwave patterns for longer. And you're remembering, and you're also more connected to your body. So when you're waking up, you're probably in that hypnagogic state, which is that state where you're kind of waking up and you sort of remember your dream. And when you're not grounded and you're disconnected and your brain is stressed out, it just snaps out of that and you forget everything. You just wake up kind of like ready for the day on adrenaline, and people don't remember their dreams. But when you're really sleeping in a restorative way and you've had your brain really relax and then go through those REM cycles, when you wake up, it's just an experience that you're actually enjoying, and you're remembering those dreams and that REM time. And it's so good because REM time is when we really process and integrate our life and the stressors of our body and kind of make sense of it. And so the fact that when you're grounded, it's enhancing that is awesome.
Well, and that makes a lot of sense. And the other thing I've noticed when I exercise, my recovery time is a lot faster, and I don't have the soreness that I used to have.
Yeah, and that's that's replicated in multiple medical studies that it's called DOMS. It's a delayed onset muscle soreness. So it's after exertion, you do micro damage to your muscles. As they're getting stronger, you do little tears, and you can actually measure that in your bloodstream, blood inflammatory markers of inflammation and muscle damage. And when people are exercising grounded, and or if they exercise and then ground, so with your mattress, for example, if they work out, they're an athlete, and then they sleep grounded on your topper or your mattress, medical studies have shown they have decreased blood markers of inflammation, decreased muscle damage, and then they report subjectively decreased soreness and increased recovery. So you're exactly right. You're in tune with your body and you can feel that difference.
It does make a difference. And,
Yeah.
you know, to go back, you mentioned the reduction in chronic inflammation. And a lot of what you read today or hear in the news, chronic inflammation is being linked to more and more long-term health problems.
Yeah, absolutely.
And so the benefit of grounding, do you see a benefit there?
Oh my gosh, yes. And for so many reasons. The first one we started really realizing is medical studies have started to show that really dementia might just be chronic inflammation in the brain because of maybe the foods we eat or our environmental exposures or just stress and cortisol levels being high or a lifetime of wear and tear and abuse. And that it's linked to dementia. Depression is actually linked to inflammation. When you give someone anti-inflammatories, their depression is actually treated. You know, obviously we know it makes sense that the wear and tear on our body, so arthritis is inflammatory related. Cancers are now being shown. There's many cancers that show increased markers of inflammation linked with particular cancers. So what we're really realizing is maybe all these, what we would call, you know, aging, you know, just slowing, our joints slowing, our mind going, maybe that isn't really natural. Maybe it's the way we live in our lifestyle, making inflammation in our body in abnormal amounts. Well, grounding has been shown to directly reduce blood inflammatory markers, decrease inflammation in PET scans, MRI imaging, blood inflammatory markers in many, many ways. And it does it pretty quickly. So you can imagine, and my prediction would be, yes, Rob, I really hope we get decade-long studies that show people who have the practice of grounding or sleep grounded or ground indoors, hopefully over a lifetime, they've had a much reduced level of inflammation for decades now. And that should, I would absolutely expect, decrease what we normally say, you know, normal aging or chronic inflammatory diseases. I would think those would go down. And not just those. The other thing, it's not just inflammation. The other thing that is really boosted is our metabolism and our glucose. And what I see, one of the biggest challenges to our health in our, at least in our Americanized society, is diabetes and heart disease and metabolic syndrome. And that's because our blood glucose is all over the place. We eat crappy food, you know, we're not exercising and we're not grounding. So we have so much inflammation and it affects our body's ability to process food and to stabilize glucose. And that's another way. Grounding has been shown to decrease fasting glucose and really boost our body's ability to handle digestion. And so that's another way I would predict over the long term, decreased metabolic syndrome, decreased diabetes, decreased heart attack risk. So for both of those reasons, it's amazing to think the potential. You know what else is kind of weird too, is that we don't already have these studies. That means, Rob, that for generations now, we've been living totally disconnected. Because why don't we already know? Do you know what I mean? Like, why haven't there been people just living connected to the earth? There haven't been yet. We're the first generation to really start going back and realizing this is a healing modality. Something's wrong when we're really isolated and indoors and not resonant with the planet that we're on. I mean, that's weird. But we're yeah.
One thing I was going to ask about that is, you know, people who tend to have outdoor lifestyles or hard work, you know, say a farmer or a forester or somebody working there, tend to have less of the diabetes and those types of, you know, modern illnesses that we suffer from. And I wonder if there's some connection to that.
Oh, for sure. There has to be. And not just for grounding, but for the fact that their circadian rhythm, because of the earth and because of the sun and their light exposures and their being in that Schumann resonance, that natural EMF frequency. So their night is more restorative and their day, they have more energy and their inflammation is decreased the entire time. So yeah, I mean, that's like a way healthier lifestyle. But what's great about Carico and other companies that embrace the reality that grounding is the natural state of the human body is that even when we can't be a farmer and, you know, we can't have jobs that allow us to be outside for long periods of time, we just have to do it intentionally, but we can still connect to the earth.
And I think that your book made that point with all these different ways of grounding. And there were things that hit me, like swimming in the pool and you're grounding. There's so many things we can do. And we know how great we feel, how great we sleep after a day that you're at the beach or in the pool. And easy to do more of this stuff with your suggestions.
Well, thank you. That was my point, because a lot of people first of all, there's a lot of people with mobility issues. So when people say just go barefoot, well, that's not even fair. They maybe don't even have the ability to ambulate even. And then also like thinking that you have to save it up for that one beach vacation and that's the only time you're going to be on the earth. It's just not realistic. And then a lot of people also live in urban environments and they don't have a yard. So then they're like, well, I guess it's not for me. And that's actually not true, because anybody can ground. You can ground through a sidewalk. I tested it. You can stand at a street corner, when you push the little button to like get your little signal for the crosswalk,
Right.
that metal pole is grounded. So I can just rest my hand on that while I'm waiting to cross the street. So there's just thousands of ways that we can ground that. If we knew about it, we could go through our day grounding, and then we could go through our night grounding with indoor grounding products too. So it's definitely very accessible if you just know the tricks and tips.
Yep. Well, the one suggestion I didn't see in the book, and I did a lot of this growing up, living in Cleveland in the snow, was snowballs and snow angels.
Yes. If it's slushy snow, that would be definitely conductive.
Yep.
That dry powder, maybe not. The dry powder would be like dry sand at the beach. If it's too dry, maybe not. But if it was those slushy kinds, you were definitely grounded the whole time. Yeah.
Excellent.
That's awesome.
Doctor, I really want to thank you for your time today. I know you're busy. You gave us a lot to think about, a lot of great tips. Anything else you can add about grounding?
I'm just thrilled to be here, and I love connecting with you at Carico, because I really admire what you're doing, and I love that you see, along with water filtration and air cleansing and healthy cooking, you definitely have grounding as a huge piece of the pie to maintain wellness, and I'm 100% there with you. So thank you so much. Well,
in your book, The Earth Prescription, you can visit intuitionphysician.com, correct, for your website?
Yep, that's awesome. They can get books there, other holistic healing products. And I did just launch a book club. Starts next month. So if you're new to grounding and you just really want to get little bite-sized pieces of information about grounding without an overwhelm, it's a fantastic resource. So you can sign up for my book club there too. Well, congratulations. And I can't wait to see what other feats you add to the list of artists, holistic physician, and whatnot. So I look forward to seeing what you do in the future. Yeah, it's good to see you, Rob. All right. Thank you. Bye. Bye-bye.